Okay, so the topic today is neutrally correct body posture. So what is neutral body posture and why neutral body posture can be correct and incorrect? So I would like just first start with getting everyone to close your eyes. Wherever you are, just close your eyes and just start to take a breath in and breathing out. And starting to observe how your head is positioned. Thinking about where your head position is, if your head is, do you feel your head is slightly forward, tilted towards the right, tilt towards the left? And observe how your shoulders are positioned. Do you have one shoulder slightly higher or lower? Do your shoulders rounded forward? Do your spine rounded forward? And also observe your arm positioning. Do you have your arms by the side of the body or you're leaning to one side? And also observe your sitting posture, or if you're standing, how you stand. If any part of the body, when you are in this position, you may start to feel discomfort if you have your head tilted to one side. Now you may open your eyes. Now look at this lady. She closed her eyes and she has her head tilted slightly towards the right. So that is her neutral body posture. But this may not be the best posture because when she has her head tilted towards her right shoulder, she may start to strain the neck on the left. Okay, so let's move to the next one. Now the content, what we are going to discuss today is what is a neutrally correct body posture and how does your body posture compromised? And how do the body respond if the neutral body posture is incorrect? And how can you remedy for the poor body posture? Let me just try to see if I can get rid of this. Okay, all right, let's try again. Look better. Now, a neutrally correct body posture is a posture where the body is aligned and balanced in any position. Now, looking at this lady, she has her right foot on the ground and the toes are pointing towards her head. She may be not in an upright position, but this is her neutral body posture when she put herself in this position. It's neutral because she does not seem to strain her left hip, where her left hip and her right hip are stacking on top of each other. And now observe how much she recruits her core strength. Look at her abdominal muscles. And then when she looks up towards her left fingertips, it actually helps her to balance her arm. When the arm is up, one is up, one is down. And she actually lengthening the whole arm in an opposite direction. And this helps her to maintain in this neutral body posture. When she is in this neutral body posture, she feels minimal stress to any of the muscles, ligaments, or bones. And at the same time, she's able to breathe. She's able to breathe as normally when she holds in this neutral body posture. And she has actually feel that she has maximum control. Now looking at this runner and the lady who is leaping forward. When we do any exercise or when we are in certain activity, there's certain posture that is mandatory to maintain a neutral body posture. For a runner who wants to sprint fast, you can see his right toe is starting to spin off and his whole body is leaning forward and he's ready to sprint. For this lady who is leaping her right foot forward, you can see she has her right heel pointing towards the ground, and therefore she is going to have her right heel to ground, and then she can leap forward with the other leg. So talking about all this neutral, correct body posture, for many of us, we may start to feel that we may be struggling even when we are trying to sit upright, and we may feel that, oh, after a couple of minutes, we may feel that the lower back start to ache. And when we are standing, we may feel that we may not be able to stand for too long, and certain part of the body start to ache. When you feel the pain, that is a that is a warning from the body that the posture may not be in the correct neutral body posture. So how does the body posture being compromised? Now there are three reasons. Reason number one, primitive reflex. Primitive reflexes are present when we were born. For every baby that was born, there are many different types of primitive reflexes, and all these primitive reflexes needs to be fully integrated into the postural reflex when the infant starts to develop. And all these primitive reflexes should start to diminish over the first 12 months of life. If not, if the postural reflex is not fully replaced, the primitive reflex in the first 3.5 years of a child's life, then there will be a lot of compensatory mechanism or a lot of problems downstream. Now, looking at this young girl, she is trying to walk and stand properly, but her primitive reflex is retained and is not, and the postural reflex has not fully taken over the primitive reflex. And therefore, you may see that she is beginning to flex forward. Her hips are internally rotate, the knees are knocking towards each other, and the toes are pointing towards each other. Postural reflex is the basis of automatic control of your body posture, your balance, as well as your coordination. Look at this lady. She keeps her head and her pelvis upright in one line position, and in this way, she can balance herself on both sides of the body. When the biggest enemy of our body posture is the gravity. The gravity keeps pulling us down, and therefore the postural reflex needs to readjust when we put our body in various positions to maintain the best neutral posture in the position that you put your body in. When you feel that you are upright and you are in control, neutral spine position, this is when the body is starting to relax. Now, we also would like to talk about the righting and the equilibrium reactions that we have from the postural reflex. The head and the pelvis is the first thing that we always look at. It should be right in the middle. Okay, they should be stacking on top of each other if you are in a standing position. And this is organized by the limbic brain that controls the labyrinthine head righting reflexes. Now, I'm going to give you some examples of the postural reflex. We talk about the head and the pelvis control. The neck should be staying in the middle and keeping the head and the neck, the labyrinthine head righting reflex, keep the head and the pelvis in balance on both sides, on the right and on the left. Especially when you start to move from sitting to standing position, the postural reflex will allow you to realign and then align yourself in the standing position. Ocular head righting reflex, we rely on the gaze. Allow the gaze to remain focused at one point and fixated at one point, and therefore keep us in an upright position. Now, looking at this girl, the top picture, this girl has her postural reflex matured, integrated. But for the in the bottom picture, you can see this girl, she does not have her neck and the pelvis. She doesn't have the strength to hold her arms up, and therefore she's resting her right wrist on the ground. She's resting her right knee on the ground. And that tells us as a practitioner that she does not have the head and pelvic control. And this is why through this examination, we start to treat patients and give patients some rehabilitation exercises. Another example of the reflex is segmental rolling reflex. So if you attend my yoga class, I usually teach adult patients and students how to carefully roll over from a facing up position, roll over to the side by first having your head to turn around the axis of the body, followed by the shoulders, and then followed by the pelvis. This is called a segmental rolling reflex. Again, all these reflexes should be matured by 3.5 years old. But for a lot of people, they may not have been fully matured. A child starting to learn to stand and walk. Some children may not even go through the phase of crawling. And that is something that we like children to be, we like infants to be able to have this flying like an aeroplane position, be able to do that before, and then they can then lift their head and lift their chest up. Then they start to be able to crawl and then stand and walk. So these are step by step where a child should go through. If they were to miss any of this milestone, that could be a problem when they grow up. Meaning they may not be able to maintain the equilibrium reactions, which require the maturity of the nervous system in the body, and also have good muscle power. Now, looking at this lady, in order to maintain in that equilibrium position, she has both palms on the ground. She has her elbows locked. And then in order for her to balance in this position, she need to look down. And you can also see her neck is pretty level with her upper back. Of course, with the right leg turnover, not everyone can do that, but I like to explain how is she able to balance in this posture. And she start to recruit her abdominal muscles, strengthen it, and then start to kick the left foot out to the side to balance with the right foot on the other direction. So our body, if have the postural reflex being integrated at young age, should be able to activate the righting reactions and maintain the body in an equilibrium position in any position that we put our body in. And sometimes we may not be able to do it. And therefore, there's a series of milestones for people who are not able to maintain an upright position with the head and the pelvis in the upright position. There's a milestone that need to go through to rectify that. And we're going to talk about it later. Now, number 2, moral reflex. Moral reflex is one type of primitive reflex. If it is retained, if it does not go away within 2 months after the baby is born, then you may find that the baby, when he or she grow up, the muscle tone is pretty tense, and he or she may not be able to sit still for a long time. Sometimes it's not that a child doesn't want to sit still, but it's because the moral reflex is still retained or has not disappeared and mature to integrate with the postural reflex. And therefore, this is why when we assess patients, we will look at different body posture and also the reflexes if they have been integrated correctly. And for some children with a lot of frequent ear infections, that could be a sign of motor reflex retention. Or the TMJ or the jaw, poor tongue and lip functions, which leads to poor head and neck position. Motion sickness, low immunity in the body, nightmares, night sweat, not sleeping well, all these are just some of the downstream problems if the motor reflex has not disappeared. Reason number 3, repetitive injuries from habitual posture depends on how you have been using your body. On the right-hand side, on your right-hand side of the screen, the green dots and lines, these are the aligned ideal posture. But if someone with, for example, a foot arch problem on the right foot, the body will start to compensate by bringing the right knee in and then pushing and starting to rotate the left pelvis forward. You can see the left pelvis is slightly rotated forward, and then the left shoulder start to round forward and the whole spine start to twist towards the right. So as a practitioner, as a chiropractor, we usually will assess patients' alignment of the spine and then the alignment of the pelvis, knees, ankles, shoulders, elbows, and wrist. All this, all this repetitive injuries from habitual postures, such as looking down on the computer with the head chin tuck all the time, or a person may have head injuries or whiplash. These injuries constantly shape and remodel how the body will develop, especially for young kids, as the body start to grow. If this problem is retained and does not go away or not fixed, it will become a problem because the skeletal structure or the bones will still grow, but may not be growing in an aligned position. So that becomes a problem as they grow up. And therefore, it reduces their ability for the joints to function normally. Traumatic injuries. For anyone who have had an accident, be it a physical trauma like a car accident, be it a chemical trauma or emotional trauma. All this trauma will create stress in the body. Now, in this case, if you look at this head on the head injury, when there is a car coming from the left and therefore push the person's head towards the right. And if you look at this man in the not aligned position, the whole shoulder moves towards the right, the whole spine moves towards the right, and the head moves towards the right. Now, this is his neutral, incorrect body posture. As compared to the right-hand side, it's all aligned. Because if someone who has ever had an accident or a trauma, normal chiropractic treatment would not, or adjustment would not fix it for a long term. And therefore, what we do is we adopt a technique called neural organization technique. We need to look into the nervous systems of what has the cranium, what has caused injury, especially the injury around the head and different parts of the body, and to fix that. We'll talk more about that later. Daily life activities, repetitive wrong posture. Now, a lot of times we are trying to exercise, but we may not be doing the posture correctly, and we keep repeating the posture. For example, on the right-hand side, this young lady is doing a standing bow. If you can see it looks beautiful on the before photo. You can see her right hip is high up towards the sky. And of course, the palm shouldn't be on grabbing hold of the outside of the foot, but the right hip externally rotate or tilt back will become a problem if she continue to do that posture in this way for a long time, she will start to have pelvic rotation, rotate towards the left. And therefore, it is really important when you do any exercises, you need to do it correctly. Sometimes you cannot see how you do, and therefore you need someone to be able to coach you. So sometimes it's worthwhile to spend some time with, an instructor or a practitioner to really properly investigate and assess your posture. The hip should be down, the right hip should face down when she does this posture. Another example, looking at this lady trying to bring her forehead towards the leg. A lot of us have tight hamstring or calf. If we have tight hamstring and calf, we need to bend the knees. And that is a correct modified posture for anyone who has tight calf and hamstring muscles. Okay. So whether you move into a posture wrong for many repetitively, or there's lack of movement or move too little, all this create problems and create stresses for the body. Another example is if you look at the left hand side of the jaw, in the middle there is the jaw protrusion. The lower jaw move forward, or the mandible move forward. If the mandible move forward, will cause someone to start to sway the hips forward. If the maxilla or the upper jaw move forward, that person tends to have his or her head tilt forward. So these are the assessment that we do for patients when we assess the body posture. And therefore, when we observe something has gone wrong, we will give advice to the patient to how to correct the posture. And sometimes a lot of pain can go away by just correcting the wrong posture. Compensatory mechanism. Now, looking at picture number 2, that is a perfect posture to be in. Again, hamstring calf may not allow you to bring the head towards the knees. And a lot of people, when they see someone is doing this posture, they will try to bend forward, and because of the tight muscles on the calf and the hamstring, they may round their body, especially the lower back. Look at the bottom picture. The lower back is rounded, and then around the thoracic and the lumbar, the upper and the lower back transition, on that particular vertebral body, it will create a lot of stresses on that vertebral body. And therefore, back pain, subconsciously, you may not understand why you have back pain, but if you repetitively do this posture, you will have back pain. And therefore, if you have someone like me to assess you doing the posture, I would then give you guidance if you were to do this posture correctly, you need to bend your knee. Okay. And compensated wrong position, wrong movement, unfortunately create a lot of problems or pain in the body, because the muscles are stretched in the wrong way. Another example is on the photo, you can see the psoas muscle. The psoas muscle on the right hand side is shortened. When that muscle is shortened, because when we sit a lot, the psoas muscle will start to shorten. When this muscle is shortened, it tends to push the pelvic bone back, and therefore we start to have lower back pain. And again, as a practitioner, I look at the positioning and I will do assessment on the different tight muscles, and then be able to give you some guidance on why you have this back pain. For the previous case, it could be due to wrong positioning, wrong posture, wrong repetitive movement. In this example, it's because of tight muscles at the front of your hip, and therefore you have lower back pain. The body is good at compensating for shortened and tight muscles and create another problem for your lower back. Therefore, a lot of times it's very hard for patients to understand or notice, why do I have this problem for a long time? And when someone is able to tell you the exact reason that you have this problem, the pain will just go away. And therefore, what I'm trying to what I'm trying to get to the point is, it is important for us to retrain the joints that do not work well and the soft tissues like muscles that do not work well. We need to train these muscles and joints to be able to move correctly. And you can do it with proper guidance from practitioners and instructors like myself. Now, there are strategies to regain neutral, correct body posture. These are the strategies that I usually adopt in my treatment plan for patients. Firstly, I will look at the whole skeletal structure of the person, and then I will assess if there are any soft tissues that are tight. And we'll use either shock wave therapy or active release technique to help the patients to release the soft tissues that are tight. Now, when the tissues are starting to be able to come to, are not tight, they start to breathe, then we need to retrain the brain to enhance the postural reflex. Do you remember what we talked about earlier? When the postural reflex is not fully integrated in the body systems, it will create a lot of downstream problem. And therefore, I go through the neuro-organizational technique, sacro-occipital therapy, and then provide patients with brain rehabilitation to retrain the brain to start to recruit the correct muscles and start to keep the posture upright again. And step 3 is then do the body rehabilitation, starting for you to stretch the muscles, strengthen the muscles, and then improve on your breathing and core stabilization. So this is an essence of the treatment program that I usually advise for patients. With the soft tissue release, shockwave therapy is very effective because it uses electromagnetic sound wave to specifically localize on the pathological or the problematic muscle and the joint and the tendon problem that you have. When we use the sound wave to apply on the problem area, that area starts to increase the blood flow and therefore speeds up the body healing process. It also helps, shockwave therapy also helps to break any scar tissues, adhesions around the joints that were injured. And this it also treats any calcification and fibrosis. Usually 6 to 8 treatments can effectively relieve the pain. In addition to that, I do active muscle release for patients. And this is very specific mechanism where I will apply certain force on the injured muscle and get the patient to move the joints for the soft tissues to be released. Now we talked about the postural reflex earlier. And the technique that Dr. Reza and I use to treat patients, for every patient that come in, is the neuro-organizational technique. And this is a very powerful technique because it stimulates the vestibular system. Vestibular systems is around the ear area and is the internal GPS systems for the body. We do a lot of acupressure points and also stimulate the brain in different ways, touch a lot of working on different touchy points. And this helps to integrate the visual, auditory, the motor planning of the body, and also the proprioception, the body positioning, the joint positioning. All these are subtle. So what we do is we lay the patient on the table and we just do all the work for about 10 to 15 minutes. And then we assess everything that we do, we assess and make sure the body goes strong. Now the NOT is a neuromusculoskeletal integration to educate the vestibular systems to inform the brain about the exact position of the body and how to execute every movement appropriately without stressing the muscles. So these are just some of the examples, the points that we work on. And then we even bring our hands to go into the jaws and just to work on the inner mouth to help to enhance the postural reflex that we talked about earlier. The other technique that we use on the right top corner, you can see sometimes I put a lot of blocks underneath the pelvis, and that is really to create a correct relationship between the base of the spine called the sacrum and then the occiput. We categorize patients in category 1, 2, or 3. High shoulder, high hip on one side, head tilted. All these are natural neutral position for you, but it may not be correct. When we identify problems on certain part, whether it's on the head or the hip, we start to correct it using the sacro-occipital technique and the neuro-organizational technique. Now, after we've treated patients, we'll then encourage patients to do brain rehabilitation. Now, there are different techniques that we use. Brain gym is one of them, and it's really good to really train the eye tracking and also working on the right and the left hemisphere of the brain, integration from the right to the left hemisphere of the brain. We also teach patients to do motor imagery, like mentally imagining how do we perform certain activities. Imagine that movement and then carry out the movement. And therefore, when I teach yoga, I will demonstrate. So I would demonstrate the posture. So it creates a mental imagery for the students to have a clearly vision, how should the posture look like? And then they carry on with the posture. Or sometimes I get them to experience the posture. Then I demonstrate so they know what problem they have and then they correct it. Motion reference learning is another technique that I use as part of the brain rehabilitation for patients. When the brain is integrated with the postural reflex, when the muscles are not as tight, then I upgrade the patients to breathing exercise and stretching exercise through yoga, making sure the head and the pelvis are in the center in any movements that they do. And also start to train the stability and endurance of the body posture. Dynamic neuromuscular stabilization is another program that I do for students and patients. Now, this is a very good program where I train patients and students to maintain core stability, correct movement, breathing techniques, and how to move from facing down to standing up and then lying down. All this, you need to activate your core and then have good breathing techniques to go with it. And we move on to strengthening the muscles. There are different pictures here on the right top corner. You can see the two ladies doing this posture. They look beautiful. The posture looks beautiful. If I were to critique on this posture, the neck, the head migrate forward and therefore create a lot of tension on the front of the neck. And therefore, if I were to correct this posture, if the head, the chin can start to tilt towards the neck, that would help these students to maintain a neutral posture. Now, on the right bottom picture, again, same thing. You can see the upper back or the neck start to dip in, and that is not what I would encourage students to do. We want the sternum to push up. The upper back and the neck should be neutral, and that is a good neutral body posture. If I were to correct this posture, looking at the man in the middle, his posture, you can see flow and beautiful movement, and he seems really calm. That is a very powerful posture. And he did it perfectly. And the picture on the left side is a lot of training on the neck flexor muscles. A lot of time when we have neck pain, it's because the neck muscles on the back is too tight. When you learn to do the strengthen the neck flexor muscles, usually it's a very powerful muscle strengthening technique for the neck. I teach Pilates, teach students how to isolate the joints and then move the joints that needs to be moved and recruit the muscles that needs to be worked on. And lastly, the top of the strategy is primal movement. And this is not for everyone, but it's the foundation of advanced movement. If you were able to bring your head down and the chest down and start to move low, that is a very, it may look advanced, but that is actually a fundamental needs for correct movements, where you learn to move with less effort and less tension on the body. That's all I have. I have my contacts here. If you want to call the reception to book in and to see me, and if you are not on the Gold Coast, I usually do online consultation, and you're welcome to contact me directly. Now, I've talked enough. Just would like to find out if there are any questions at all. I will just check the chat box. Does anyone have any questions?
Can I ask a question? Thank you very much. That was very interesting. Okay. So if somebody's got a habitual posture, say, that's tightened the psoas, how long, if it's been years and years and years that it's built up, how long do you think it's reasonable to for it to become looser again?
Yep. Thank you for the question, Jenny. Chronic problems, usually we would recommend 12 treatment sessions, and that include, in the first 4 to 6 treatments, we will start to assess how does the patient respond, and it's really depending on how does the body respond to the treatment. If the body respond well, and also I usually will give a lot of information. I will usually assess. I'm usually passionate about what could have caused the psoas tightness. Could it be sitting down too much? Could it be incorrect sitting posture? Could it be no stretching of the psoas over the years? Could it be any injury in the past? So we identify the cause of the problem. We still do the treatment, but at the same time, I will get patients to do some, to be mindful of certain posture or sitting posture that could have created the psoas tightness. In addition to that, after 3 or 4 treatments, I will start to give the patient some rehabilitation exercises, some stretching exercises, some strengthening exercises according to the strategy that we discussed earlier. And it's also depending on if the patient is compliant or have time to do the exercises, or remember not to sit too long. So all this, a compliant patient usually should progress pretty well. So the length of time is very subjective to the condition and also the compliance of the patients.
Thank you. Thank you.
Thank you, Jenny. Sally has a question. So the painful knots on the left shoulder blades. So she was saying that she doesn't have time due to So how to lose the knots around the scapula or the shoulder blades. So again, that depends on what is the repetitive movement. Now, if it's a left shoulder blade, there could be certain movement of the shoulder that keep moving the shoulder back, that could have jammed certain part of the ribs or the intercostal muscles or the rhomboid muscles that could have created the repetitive movement. So yeah, it's very, 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 I have not fully assessed your problem when you came to see me last time. So if you're happy for us to catch up, online, you're in Singapore, we're happy to talk about what could have contributed to the problem, and then we'll start to assess, and I can refer you to a chiropractor that I know in Singapore to help you with if you need certain manipulation. And then I can certainly give you some exercises and stretching. Thank you, Sally, for the question. Are there any other questions? I will show my contacts again. If anyone has any questions, feel free to contact me by phone, by email, or call the reception. So are there any other questions?
Thank you very much, Alicia. That was great.
Thank you, Reza.
Thank you.
Thank you, Kira. Okay.
When is it? What's the next week's topic?
Okay, next week topic.
Next week's topic, let me just think. We've got Manuela Boyle speaking next week, and hers is, I'm paraphrasing, but it's emotions, stress, and cancer. So she'll be touching on what stress and emotions and how it's linked to cancer.
That was great. Thank you.
Thank you, Alicia. That was wonderful.
Thank you, Alicia.
Thank you. All right. Thank you, everyone, for your time. Appreciate your participation. We'll see you next week. Thank you.
Thanks so much, Alicia. It's Jane. See you soon.
Thank you, Jane. See you.
Thank you.
Bye.